Hello everyone, Dr. Kenneth Hughes here in Los Angeles, plastic surgeon. I wanted to go over some of these reviews that I received from patients. Some of them are humorous, some of them just give you perspective on what the patients think are most important. And sometimes, admittedly, those sentiments don't agree with what I may or may not think about a particular surgery or what's most important. But it's important to review the reviews because they do give you insight into the patient mentality. And although not every patient is different, the more reviews you read, the more of an idea you will get. So I will transition into reading some of these, so you see my eyes cast off to the side. So, tummy tuck and muscle repair. People who judge or look down on people who opt for plastic surgery have no idea why people decide to go through with it. As a result of carrying 5 children, the last 2 were twins, I developed a sphere hernia, a muscle tear, and extremely stretched skin. This is also known as diastasis recti. No matter what I did, no matter how much I worked out or wore Spanx, my hernia was so severe I looked 6 months pregnant all the time. My confidence was gone. One day, my friend, who also suffered from diastasis recti, said that she was going to get the problem fixed with Dr. Kenneth Hughes. Her results are amazing, so I booked with Dr. Hughes shortly after for a tummy tuck and hernia repair. The front office staff is beyond sweet, such exceptional customer service. They were so patient and answered all of my questions. Dr. Hughes also went above and beyond to answer all of my questions via email and to reassure me. So things to point out in that first little portion of that review. Number one, I do think that there's a stigma attached to plastic surgery, especially cosmetic, and I think that some people have to overcome that just to, get themselves psyched up to have the surgery. They think that they'll be victims of ridicule, and I don't know if that's really true. I think plastic surgery's evolved a lot in the last several decades, and I think the view of plastic surgery in the cosmetic realm has changed. I don't think it's something that's hidden anymore. I think a lot of people are willing to talk about it, although some like to keep things very private. The other thing that you notice is that patients sometimes know, different elements of what may or may not be wrong with their physique, and then how you choose to fix that as a surgeon sometimes can be difficult to articulate to the patient. And sometimes you can't explain every aspect of how you may fix a certain parameter, a certain anatomic parameter. And that's okay. It's just important that a patient knows that they want something to look better, and you know how to achieve that. And as long as you're on the same page as far as what the patient happens to be bothered by, and then you as a physician are able to target that and rectify or remedy that, then I think that that's fine. The other thing is that a lot of the patients, they may put a large emphasis on office staff answering phones, what they call customer service. Now, the only thing I would say about that is plastic surgery is not your typical, it's not a service industry in the general sense. And so it's important not to place too much emphasis on